Well, hello there. I'm Congresswoman Shelley Pingree, and I am very fortunate today to have a chance to talk to Olivia Pennington, who is at Maine Family Planning. She's the Director of Advocacy and Community Engagement. And thank you for joining me, Olivia. I'd love to talk to you a little bit about some of the challenges you're facing.
Absolutely. Thank you, Congresswoman Pingree, for making the time today.
Of course. So, I know you're really impacted by the Title X funding freeze, and this impacts so many Mainers in ways that they may not know yet, but will be experiencing. You guys provide such vital health care. And can you tell me a little bit more, just as we get started, about the funding freeze and what it means for our state?
Absolutely. Yeah. So we are facing multiple funding attacks from the federal administration. At the beginning of April, we were notified that our funding for the Title X program was being withheld. Title X is the only federal program ensuring that low-income folks and uninsured folks can access life-saving healthcare like birth control, STI testing, and cervical cancer screenings. At Maine Family Planning, we are the statewide Title X grantee. So we use those funds to support our 18 brick and mortar clinics, as well as our mobile medical unit. And then we subgrant those funds out to a number of other health centers, including the 4 Planned Parenthood health centers in Southern Maine, 32 federally qualified health centers, and 8 school-based health centers. So when we're talking about the Title X network in Maine, we're really talking about a cornerstone of Maine's public health infrastructure.
Yeah, thanks for sort of laying that out there. I know the first time I was sort of looking up the reach that you guys have because Title X funding comes through you. I hadn't really thought about the number of clinics that you impact, and that just includes a lot of Mainers who get their services through those clinics, whether you operate them or not. So, how have you been able to continue the services that you provide since that funding block?
Absolutely. We are doing the best we can to continue to fundraise and to fight at the state level for state funding to step in and ensure that Mainers can continue accessing this life-saving healthcare. This year, we are really thankful to the Maine State Legislature for fighting to get us $6 million dollars to support the Title X network for the next fiscal year. That, of course, only covers us for 1 year. On top of now facing this Medicaid defunding from the federal government, we are seeing relentless funding attacks. We need stable, consistent funding to ensure we can continue providing this care to the thousands of Mainers that rely on us. We can't be coming back every year to beg for more money, right? We need sustainable funding so that Mainers can continue accessing care like cancer screenings, birth control, HIV testing, stuff that really saves lives. And we know that the patients we serve, if we are forced to close clinic doors, likely won't be able to access healthcare in other areas. We serve a lot of the really rural reaches of the state. We have health centers in Calais, in Fort Kent, in Dexter, in Rumford. And we know that we are a state without a public transit infrastructure. Without their local Maine Family Planning Health Center, many patients may be left with no options for healthcare.
Yeah, I think that's one thing that people don't really understand. You just mentioned some of the services that you provide. You know, a lot of this started with this administration's opposition to abortion care. And so then they've sort of branched out into this area that's now reaching into family planning or vital and critical screenings. It goes far beyond that. And in many communities, as we know, Maine's a very rural state. There aren't a lot of places to access care. And so if you're not there or one of the clinics that you support isn't there, there's not necessarily any place nearby for people to go.
Absolutely. And for a lot of folks, we are their sort of jumping off point, right? Folks know they can come into us because we see everyone, regardless of their ability to pay, regardless of their insurance coverage status, which is unusual for a healthcare provider. So when folks come to us, for example, for an annual breast exam, we may then be able to connect them to other resources and ensure that they can get in the door to get this continuum of care to ensure that they're accessing this really life-saving healthcare.
And we all know how vital that early screening is, you know, whether it comes to breast cancer or other diseases and concerns that people have. If you don't get the kind of wellness care that you need, you may find out about a disease way too far down the road. when it's either very serious or it's very costly to treat. And we don't want Mainers put in that position, but that is fairly likely what could happen with, as you said, both the block on Title 10, but also the Medicaid cuts that were in the big ugly bill that I opposed. But those Medicaid cuts, which have yet to kick in, could have a huge impact. And we often talk about how this could make it so that more of our rural hospitals have to close. And we know that's a very high profile thing when a Maine rural hospital closes or any hospital has to cut back on services. But we often don't think about the huge number of other clinics that there are that people depend on that could be severely impacted by these Medicaid cuts.
Absolutely. Yes. So we are now no longer able to bill Maine Care as insurance for our patients because of these cuts from the federal administration. And I want to be really clear that the Trump administration and Congress are preventing Mainers from using their insurance, Maine Care, for accessing these really basic services like birth control, cancer screenings, and routine OBGYN appointments. And you're absolutely right. These Medicaid cuts have a larger impact on our entire healthcare ecosystem in our state. If we are forced to close clinics and rural hospitals continue to close, this strains the entire system, leading to longer wait times to access care and fewer providers for folks to access care with. Without Maine Family Planning, the infrastructure of our whole state network will crumble and our patients will be left without help.
Yeah, and it's really, I mean, it's just so hard to sort of be in this moment in time. I was lucky enough to get elected when President Obama did, and we first passed the Affordable Care Act. Also, we're expanding Medicaid to more states and making it possible. And Maine has done such an incredible job of making sure that more people were covered under Maine Care and that there were more services available. And now everything this administration is doing is really talking about taking away care. And one of the arguments we made all those many years ago when we were working on the Affordable Care Act was to say, if people get the basic services that they need, they stay healthier. They're more likely to be able to stay, taking care of their families or working at their jobs or all the things that Mainers need to do to have a fulfilling life. And now we're just systematically destroying all of these systems. And I think in the long run, it's going to have a huge impact on the quality of life for Mainers, and our ability to sort of operate as a state.
Absolutely. It's something we say all the time, and we mean it. Family planning is life saving. This
Right.
care we provide is truly life saving for a myriad of different reasons. We treat disorders that prevent folks from being able to go to work, from engaging with their hobbies, from engaging with their loved ones and families. And access to these clinics allows them to be their full selves with their families, their jobs, members of the economy, and Mainers, right? Their full selves as Mainers.
Hmm. I mean, it's only been a couple of generations since we've had access to basically family planning, birth control, but it's made a huge difference in the lives of women and families, people being able to choose when they decide to have children, when's the best time in their lives, making sure that they have the number of children that they prefer to have, and that, people can live fulfilling lives and they can be more successful in the economy. And I don't mean to look at it in sort of a, crass external way, but we've come a long way. And we often say this administration is so ideologically based. Not only are they going after abortion care, but they're going for family planning and these vital services. And even if they maybe don't have a big poster up saying, we don't believe in birth control, the fact is, if in essence they take away your ability to access that level of care, or for people to have those services or afford the services, then in the long run, we're just saying, you're taking away rights from women and their families, and you're making it less possible for people to do well in a otherwise challenging time in this economy.
Absolutely. Absolutely. This recent move to block Medicaid reimbursements to Maine Family Planning and Planned Parenthood of Northern New England, is clearly punishment for providing abortion care. And we are proud to provide that care, and that care is legal in Maine. And this amounts to a backdoor abortion ban. This is an attempt to close clinic doors and prevent Mainers from being able to access the whole range of sexual and reproductive health care services that are so central to leading healthy, fulfilling lives.
And there aren't a lot of other places to go. I mean, that's the thing. Um, if you have an ideological difference with certain kinds of clinics, But yet you provide no alternative. You're really denying people that level of care.
Right. We know that many of our patients live in really rural areas of the state and may not be able to drive 2, 3 hours to the next clinic if their local clinic is forced to close.
Right. Well, we really appreciate what you do. And I know Mainers are very grateful. Even if they don't know the name of your organization or that you exist, they may well have interacted with one of your clinics or services or another clinic that you help to provide for the funding that they do. So I appreciate what you do very much. Is there anything else you think people should know about the challenges that you're facing and why it's so important to reverse what's going on in Washington?
At Maine Family Planning, we are the largest network of sexual and reproductive health care providers in the state, and we are really proud to have clinics in places that are federally designated as medically underserved areas, ensuring that all Mainers have access to this basic life-saving health care. We are going to continue doing everything we can to keep clinic doors open and continue seeing patients. But we are in a really tough spot. And if the courts don't intervene within the next few years, we may be looking at some really tough decisions, including closing clinics, cutting services, and having to start turning patients away. We have been proud to say that we never turn patients away.
And we're very grateful that you do that. That is a really vital service. That is one more thing I should mention. So you are now part of a lawsuit to fight back, and many of the Trump cuts, which we consider illegal and unconstitutional, have been reversed because of lawsuits. Do you want to describe at all what's contained in that particular lawsuit?
Absolutely. So, Congress and the Trump administration have violated the Constitution's equal protection guarantee when they singled out and targeted some abortion providers in their budget reconciliation bill. This is a move that prevents Mainers from being able to choose to see the provider that they trust. Our providers are truly community based. Our providers live in these communities. They treat generations of the same families. They really care about their local communities and are proud to provide this care. We've earned that trust with Mainers. And this move, prevents Mainers from being able to choose the provider that they trust. So we are suing because we believe that Mainers deserve access to this care and they deserve to choose a provider that they trust and feel safe with.
Well, thank you for fighting back. We are doing all we can in Washington to oppose bills like this and to fight back to get that funding. And we're really grateful that you guys are doing everything you can to stay in there. So thanks for taking the time to explain this to people today and help give them a better understanding about the damage that this kind of legislation is doing, and really appreciate the work you do.
Absolutely. Congresswoman, I really appreciate your time. Thank you for meeting
Sure.
today.
Thank you.